All right, so Linda, we're here to talk about Hybridge, and one of the things, as I was just saying to you, is that this is kind of a major expense in a lot of people's lives. What were the circumstances that led you to seek out something like Hybridge? What was in your mouth before?
Well, I had an upper denture that I had put in probably 6 years before I came to see you. And at the time, they told me I didn't have, the first question I asked was, can I do an implant? And they told me I didn't have enough bone. And this was obviously a competitor of yours, but I didn't think I had any other options. So I had all my uppers extracted and had an upper plate done. And it was okay. I can't complain. It was okay. But after a couple years, it never felt right. It was shifting. It never, it was always moving. And it was just getting uncomfortable. And it was happenstance that I happened to be doing a Google search for something unrelated to this, and dental implants came up, and there was one of the sites was Hybrid, so I read about it. I actually called your office. I came in for the seminar that you give, learned about it, and frankly I did research with other places that do implants as well, but I was so excited that I could have it done and not have to deal with dentures and worrying about my teeth coming out and my grandchildren waking me up in the middle of the night and I don't have teeth in, and all of those things that denture wearers worry about. So that's what really prompted me to come in. I just really wanted something that was more permanent and felt more real than a denture.
Yeah. And how did you find the surgical experience? I want patients to know about that. We had to put in the 6 implants on the upper jaw, and we did Hybridge on the lower.
Correct.
So we had to put in 5 implants there, and we had to extract teeth also. What was your post-operative experience like?
I've had dental work done all my life. Most people have. So I've had extractions before, and I've had root canals before, and fillings and all those other dental procedures. But frankly, this was for me, a cakewalk. I'm not saying I didn't have some pain, but it was very minimal. I don't think I used any pain medication after day 1. And really, it was better than I anticipated.
So I am pretty spectacular.
You are phenomenal. You are phenomenal.
And I'm glad you just gave us that smile. You look spectacular.
Oh, thank you.
I'm
very pleased with them.
That's
very
great.
Pleased.
And how do you find, every daily life now with these permanent teeth in your mouth?
I'm to the point now where I don't really even realize that they're not my teeth. You're just they feel like teeth, they function like teeth, you treat them like teeth. So to me, they're like teeth. Yeah. So I never give it a thought. I never worry about speech or what I'm eating, to a certain extent, but you would with regular teeth as well.
Sure.
But to me, it's just like having regular teeth.
Yeah, well, that's great.
Yeah.
You were a great patient through the whole thing, too.
Oh, thanks.
And it was kind of fun working with you.
Yeah.
Not on you, but with you. And so I appreciate that. And
my pleasure.
Yeah, and I appreciate you being honest with us and talking about Hybridge. So congratulations
It was
to you.
everything I expected and better. It really was.
Well, thank you. Nice time of year to do this, too. Holidays coming up.
That's right.
You've got everything in there.
That's right.
All right. Well, thanks.
My pleasure.
Great.